A federal task force recommends women should start getting mammograms every other year starting at the age of 40. Until now, women were not urged to receive a mammogram until age 50.
Joining us now is Professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher. Good morning.
Good morning.
I thought 40 was a standard at one point.
Well, it depends on who you ask. It's
Yeah.
really kind of confusing because the U.S. Preventative Task Force, who's put out this new proposed guideline, they used to say 40. And then in 2009 and again in 2016, they changed it and said for a low-risk woman, it should start at 50. But the American Cancer Society has always said 40. And these new proposed guidelines, it's controversial. Not everyone is on the same page with this, particularly the 2-year thing. But it's important to look back where this is coming from because breast cancer rates have been going up. And particularly in black women between the ages of 40 and 50, they are twice as likely to die from breast cancer as white women. So there's been this acknowledgement that this isn't working. We've got to do something. But number one, they're saying, okay, every 2 years is enough. And a lot of people are saying, no, every 2 years is not enough. It should be every year. The other thing that's controversial is this idea of what do we do about women with dense breasts? It has been well established that women with dense breasts are at higher risk for breast cancer and really would benefit from getting additional tests like an MRI or an ultrasound. They are completely silent on the dense breast issue. They say nothing. The third thing that they have not addressed is, what about women over the age of 74? They just act like you just stop getting mammograms at age 74, and most people don't agree with that either. The American Cancer Society says very clearly that it depends on the health of the woman, if she's expected to live another 10 years. So there's a lot of issues with these proposed guidelines, but the one thing that is clear is that breast cancer rates are going up. Women are dying of breast cancer, and something needs to change. But the real question is this enough? Is this the answer? And I don't think so. I don't think this is the way to go. But the other thing I want to point out is this doesn't make it law. If this passes, this is the recommendation of one group. The problem is a lot of people will go along with these recommendations, not to mention insurance companies, who might say, hey, we're only going to cover this every 2 years because that's what the recommendation is.
Okay. There was some thought that the COVID vaccine would impact women's periods.
Yeah, do you remember we talked about this, really right after the vaccines came out. A lot of women were saying that their periods got really irregular and it was the vaccine. And then there was an early study that came out that said, yeah, it looks like maybe it is making periods irregular, which is of concern because then you say, okay, what's the impact on maybe fertility treatments and people wanting to get pregnant? And it turns out that that is not the case. It's taken some time, as most big studies do, but this was a study that was just released of 3 million women who'd gotten the COVID vaccine, comparing them to women who did not, and there was actually no impact on irregular periods. There was no impact on fertility. So while we're not getting vaccines right now, the message from this is, number one, it takes time to sometimes get this data, and two, if we return to a time when we need to be getting boosters and vaccines, it's very reassuring for women to know that this is not going to throw things off in a meaningful way.
All right, is there a connection between Ozempic and hair loss?
Yeah, it turns out people are losing not just weight, but they're losing their hair. And it's all over social media, of course, people saying that I took Ozempic or one of the other new drugs in that class and their hair is falling out. But experts in this world say, no, it is not the drug that's causing people to lose hair, it's losing weight. We've always known that there are certain events in life, illness, big weight loss, that's going to cause a condition called stress alopecia, where you get a diffuse thinning of hair, which is generally temporary. And so when people lose a lot of weight, they lose hair. And in fact, if you go back to the clinical studies of these drugs, what you find is that the people that were taking the drug, about 3 to 5%, depending on the drug and the dose, did lose hair, compared to the placebo group that was not taking the drug, that was maybe 1%. But when you look at the people that actually lost the most weight, those were the ones that were losing hair. So the other concern is nutritionally, are people getting what they need? A lot of people that are eating a lot less, maybe they're not getting enough protein, enough iron, enough vitamins. So they need to stay aware of that. But the number one caution is if someone is taking these drugs and they're losing a lot of hair or patches, or it's not getting better, it might be something else. So get it checked out. Don't assume that it's, oh, this is just because of my weight loss drug that I'm losing the hair.
Gotcha. All right, Dr. Streicher's on social media. You can find her all those places. Thanks again for being here.
Thank you, Doctor. Time now for Around Town.
Hey, Anna.